Hello and welcome everyone. I'm Amit Garg, Worldwide Partner Leader from Healthcare Center of Excellence at AWS. Welcome to a new episode of This Is My Offer, a web series where we showcase innovative solutions for our leading partners. Today we have a very special guest, Dr. Ruben Amarasingham, the CEO and founder of PC's Technologies. Ruben, it's a pleasure to have you here.
Thank you, Amit. This is a real honor, and we love partnering with AWS. So thank you so much.
Okay, great. Let's start by having our audience a better understanding of PC's technologies. Can you share who PC's is and what makes your solution unique?
Yeah. So Pieces Technology is a healthcare AI firm, and our mission is to help those who help others. So you can tell from the mission, doctors, nurses, case managers, administrators working in health systems specifically. What we do is we're very focused on how do we return time and focus for these really busy professionals that are taking care of patients, heroically every day, day in and day out, by helping them with lots of their sort of clinical and administrative tasks, specifically around documentation.
Great. That's incredible. Clinicians face overwhelming administrative demands, and your technology seems to make a real impact. Can you walk us through some of the platform's key features?
Yeah. So one of the first things is we have a variety of different components. One is something called the Pieces Working Summary, which is, if you can imagine, Pieces will read everything about the patient in the electronic health record and generate a very concise clinical summary of what's happening to the patient every 2 to 15 minutes. So this is very helpful for doctors when they're doing handoffs, when they're going on and off shift, particularly in the inpatient side, nursing when they're doing their shift changes, case managers when they're coming on service and they're seeing they've got 30 to 40 patients, what's happening with my patient. We have many other use cases where we have rapid response teams using it, critical care teams, research teams that are trying to evaluate patients for research protocols, and a variety of other areas, radiology, pharmacy. So the Pieces Working Summary is sort of our core product. And then moving on from there, we have other components, for example, the progress note. So doctors have to write a daily progress note on what's happening with the patient. Pieces will write it for them by looking at all the information, making suggestions on things that have changed with the patient, writing it in their writing style. And also it will look for potential areas where they may be treating a patient or diagnosing a patient for a particular condition, but they haven't been writing about it in their notes. So Pieces will suggest that. And if you do that, then you can potentially improve your revenue capture because you're capturing more specifics on the patient that are accurate. One of our most popular products then is the discharge summary, which is a written record of everything that happened to the patient while they've been in the hospital. Very time consuming, yet very important. So Pieces will write this every day. So when the doctor is showing up to write their discharge summary, it's already completed for them. So we've been really excited. We're seeing incredible results from these kinds of capabilities. I haven't mentioned all of them, but 92% voluntary adoption by physicians. We're able to demonstrate in very high acuity internal medicine units ability to capture revenue capture of $700 to $2,200 per case. And then, of course, the most important thing for us is enormous time savings. So we're seeing cognitive demand reduction by greater than 30% by surveys for nursing and utilization management, seeing 40 to 50 minutes of time per shift saved to doctors. So number of different areas that we think this has an impact.
Thank you, Ruben. Very impressive. My next question would be around the safety and reliability. I know it's a hot topic, AI in healthcare. It's a very hot topic. How does Pieces ensure its AI solutions are both safe, reliable, and trustworthy?
Super important question and something that we take really seriously. So we have a platform called SafeRead. which literally is meant to say, is what we are producing safe to read, right? Because AI systems, that's one of the big questions. It's a platform that sits in the background, and it uses something called adversarial AI. So it's a separate AI system that is reviewing the output of the main AI and saying, is there any clinical errors here? Are there errors of judgment, of ontology, of nomenclature? It has a whole taxonomy of errors that it's reviewing for that we've developed over time. If it finds an error, then it sends it into a part of platform where we have board certified physicians at pieces that will review this information. Particularly for the working summary, they're staffed 7 days a week. And if there's any error, it will not proceed to the customer without that physician's review. We also have offline review through this platform where we can look at lots of different structural ways that the information is being presented and continue to improve that. So we call this process double human in the loop, because you have the doctor on the ground that's doing all the great work. That's one human in the loop, right? It won't go to the official certification with that doctor. But we put our own doctor in the loop. So we have two humans in the loop. And we think doing that, we've been able to show just really significant, reductions in something called severe hallucination, where we've published that we can show a rate of less than 1 per 100,000 severe hallucinations. We're really proud of in our working summaries. And we're continually trying to improve that and make the system as safe and as accurate as possible.
Great. A commitment to the safety is impressive. Now let's see pieces in action. Can you walk us through a quick demo, Ruben?
Absolutely. So if you can see my screen, the first thing you'll see, this is a typical electronic health record. And you have like a patient list, and Pieces generates this Pieces working summary for each patient. You can see it here. And if you hover over it, you can see the information. So let's start with Sarah Fuller. This is a patient that's been in the hospital for 7 days, had a very complicated course, and Pieces is generating the summary every 2 to 15 minutes. So super useful for all the teams that are looking at their patient list. What's happening with my patient? Now you can double click on that and get taken to a view inside your record, which has more information on the working summary. This is something that we've built with the EHRs as partners. And you can see, here's the information on this patient, Sarah Fuller. You can see a very complicated patient that had multiple procedures. There are some things that went wrong, including a right femoral artery laceration. It talks about that, and it talks about what's happened. You can go backwards in time and see the case from the beginning of the hospitalization. So people find this view really useful. This is when they came in. You can see that their case got more complicated. And then, of course, you can edit it. And if you edit it then as a physician, then it becomes an official summary, and it'll change it on the main list. So we find that some doctors like to make that modification, and then for multidisciplinary rounds, when case managers, nurses, and others, they have this new information. People really love it for that. I'm going to move to then the progress note. Let's go to Miss Evelyn Waters. Here's what we call the working progress note. And here, Pieces has generated the daily note that a physician has to write. And you can see it makes minor edits here, net negative 1.8 liters overnight. So here, just to spend a moment on that, the doctor here was talking about the patient's heart failure, said we have a goal weight. We want to watch the fluids in and out, and said monitor strict I's and O's. So Pieces goes into the flow sheet row and says they're net negative 1.8 liters overnight, and you can accept or reject that. And then you can see that there's changes throughout. So this makes it really easy for the physicians to edit it. It can be written in their writing style. And then at the very bottom, if there are areas that the doctor may be treating, but they may not have mentioned in their last note, Pieces will bring that forward here. This is called a point of care clinical documentation query. And it suggests these various things, and it gives an option of what might be the areas. Pieces does not make the diagnosis for them. We're staying very compliant with the coding rules. but it suggests them, and then the physician can select it, and you can see it writes that whole section of the note, including the information that's needed properly for billing and in their writing style. So with this, you can really improve, both the accuracy and quality of the note, as well as the revenue capture. There's something called the discharge summary, which let's go back to here. Give me 1 second. So if we imagine the working discharge summary is a summary of the patient's hospital course that is required for every physician to write. This is a very complicated document to write really well, especially if you're under pressure. You can dictate it, but oftentimes, dictation, you may or may not have missed details. If you're coming on to a service and taking care of a patient that's already been taken care of, you may be less familiar, so you have to go back and dig through the chart. So what we're finding is we can generate a full hospital course narrative of everything that happened. We've had patients where it's generating summaries for people in the hospital more than 100 days or 150 days in the hospital. Super complex, as you can imagine. So it's bringing that and summarizing it accurately. It's our most popular physician product, 92% adoption rate. And we also create a problem-based hospital course, which is by problem, what's happened to the patient. So acute on chronic heart failure, respiratory failure, you can see it all here. And we found some really outstanding, the doctors are using it heavily for their last note that they write before discharge. The second is we're seeing that the ICU doctors are using it for their transfer summaries when patients are leaving the hospital. So multiple different use cases that we're finding. The last thing I want to share with you is something called our utilization management summary. And this is a really important part of the health system that often goes unrecognized, which is the utilization management department, typically staffed by nurses. And the goal is to determine, is the patient in the right level of care? Should they be in the inpatient care or observation? And admit, if you get this wrong, you're leaving, you could get denied. You might have a lot more administrative paperwork. You won't get paid for the right level of care. And so, but it's still very complicated. And you have these junior nurses, in many cases, there's a significant nationwide shortage for these kinds of skilled nurses to understand these complex rules. So PIECES will essentially review the patient because it's already generating these summaries every 5 to 10 minutes. And it will review the case as it's evolving against the guidelines and then present all the information in an easy way for that nurse to review and also provide a recommendation. They have to confirm with their own knowledge of the patient of where they fit in the level of care. We're seeing incredible results with nursing departments saying 25% more productivity, which is, pretty significant with this shortage, as well as, reduce in mental demand, even happiness in working on these things. So we're pretty excited about it. But these are some of the tools. There's many others that we provide as part of our work.
Wow, impact is clear for sure. Now, as you take your solutions, platforms to different health systems, would you be able to share some success stories with our audience here?
Absolutely. I think I shared some of the metrics and numbers, which is, 92% adoption, great new revenue capture, improvement, reduction in time for inpatient clinicians. But what really speaks to me is when we get quotes like this. Somebody said, this was a attending physician said, I almost cried yesterday when I was doing my checkout of 22 patients and saw this beautiful discharge summary. These were, I think, tears of joy, but and it does such a good job that she didn't have to put all that energy, right? And we're starting to see how technology can really make a big difference in healthcare, right, for these really busy physicians. This other physician said, the PIECES working summary saved my life when I was afloat. So they were coming on, they didn't know anything about the patients. So, when you're in a float situation, you may have, 15, 20, 25 patients. that you've just been thrust into, without knowing anything about them. So being able to quickly understand what's happening without diving in the chart, this physicians sound valuable. And we have so many different things. We have physicians saying this is a game changer for them, and that we have case managers saying the discharge barrier, something we didn't talk about, the ability to identify discharge, has been, as one case manager wrote, just incredibly valuable for long length of stay patients. So lots of different value propositions for both doctors, nursing, and case management.
And I'm sure this kind of feedback speaks volumes about the value PCs brings to the clinical teams. Now, Dr. Ruben, how can health systems get started with PCs?
It's great. You can actually go to the AWS marketplace where we're listed, and you can find the PCs hospital platform listing and find out and sign up that way. We can also visit our website, www.piecestech.com, and fill out the customer contact form or the contact form, and our team will connect with you, and we can actually set up a customized demo based on what you're interested in.
Thank you, Dr. Amarasingham, for sharing the incredible work PCs Technologies is doing. It's clear that your AI-powered solutions are transforming clinical workflows and improving patient care.
Thank you so much.
To my audience, if you want to learn more about PCs, please visit pcstech.com or visit the listing on AWS Marketplace, and explore how PCs can help your organization. Stay tuned for more episodes of This Is My Offer. Until next time, thank you.